We continue our conversation this week with Joyce Hottenstein, a small business owner from Rutland, and Peter Briggs, a dairy farmer from Addison, about the politics of healthcare and its punitive consequences on Vermonters with limited financial means. Association health plans allow small business owners in a city, in one or more states, or belonging to a particular industry across the nation to band together and form large insurance pools. This way, by achieving an economy of scale, members gain access to cheaper health insurance plans. In Vermont, Blue Cross Blue Shield is affiliated with these plans, and so it doesn't oppose this option, but BCBS opposes healthcare sharing ministries. Joyce, some people would call this politics as usual, games driven by the bottom line. Others might say that this is inaccessible or boring policy talk. What would you say to that? Why should Vermonters care?
Because it affects our ability to thrive as a state, whether we can draw in employers and employees and grow the state. Or do we continue to allow people to flee elsewhere because things are becoming unaffordable in almost every aspect of life in Vermont?
And this particularly affects Vermonters with limited financial means, especially younger Vermonters?
Correct. Employees who have to shoulder the burden of, increased property taxes, increased fuel taxes, increased health care. It makes it extremely difficult for them to survive. And there are other options out there. And I think sometimes Montpelier forgets that we're not an island.
I would like also to mention here that Vermont prohibits insurance companies from differentiating premiums based on age. AARP Vermont has said that they would, quote, vigorously oppose shifting healthcare costs to the over 50 population. Now, Vermonters in their 20s and 30s have less money in comparison, but they are not organized. So what happens is that we have to end up paying for insurance plans that we increasingly cannot afford, which they euphemistically call stabilizing the insurance exchange. So Peter, how should younger Vermonters who want to stay in the state address this crisis?
Well, I know how frustrating it can be to try to engage your representatives and senators and try to get something out of Montpelier, but right now that's our only option. And you gotta change who you're voting for if you're voting for the current establishment.
Okay.
Current establishment is, by action, I'd have to say, rather indifferent to our plight. I'm not sure that they ever even understand it, considering a lot of them probably grew up with a lot more means than I have.
As a farmer, as a rural Vermonter.
Yes, as a rural Vermonter, as somebody who didn't make a lot of money and really need low-cost options. I'm doing the right thing. I'm buying into a health sharing ministry now, so later it will also be affordable for me and I won't be burdening anybody later on. I'm doing exactly what Montpelier claims they want, but their actions are showing that this was just a lying selling point. They really didn't mean it.
Right. So, and their actions speak louder than words.
Very
right?
much so.
So, as the House has just voted to eliminate association health plans, religious sharing ministries might also lose their exemption. And so, what we're seeing is that maybe we need to also get engaged.
Yes, and I have been.
Okay.
And I hope that other people will also.
So, Joyce, would you agree with Peter? Do you feel that Montpelier is being indifferent?
I do. I feel as if my representative is voting for his own agenda instead of listening to his constituents. We've had numerous conversations and he never seems to understand or acknowledge what he's supposed to be doing there, and that's representing us specifically and primarily, and representing Vermont as a whole.
A wise man once said that you can't reason someone out of a position into which he or she wasn't ever reasoned into. So perhaps maybe we shouldn't try to engage with the people in legislature, but change them?
I'd say that's the option.
That's the option?
That's what we're working towards.
And then 2020 is next year, so maybe, who knows?
Hopefully.
Okay. Joyce, Peter, thank you very much. And thank you to the Equinox for hosting us these past 2 weeks. I'm Meg Hansen, and I look forward to talking with you next week.